It is 5:31. Welcome to the Boulder County Board of Health regular meeting, June 10th, 2024. We'll do a quick board roll call. I am Morgan McMillan, board president. And Began, vice president.
Amber Johnson, board member.
And I think that we have one more board member that will be joining us virtually very soon. And the first item on our agenda is public comments. I think we do have a member of the public who's planning to speak.
Yep. All right. We have one member of the public signed up, Lindsay Loper. I'm going to make you a presenter. So you'll be able to unmute your mic, excuse me, and your 3 minutes will start whenever you're ready.
Thank you. Can you all hear me?
Yes, you're good.
Okay, thank you. I'm here again because I would like to encourage the Boulder County Public Health Board to make a statement in support of a ceasefire in Palestine. And like some of us discussed last time when we visited for public comment, of course, occupation, displacement, siege, these are against public health values. And it's important that the global professional community speak up. And this is particularly true in a sector working to repair historical complicity for displacement, institutional abandonment closer to home. Like, for example, it's Pride Month. Those of us in the queer and trans community have very salient examples with this, with the AIDS crisis. And as we continue to move through history, commitments and solidarity with the displaced and oppressed people continue to be important. And I urge you all to do that, to make those statements. And I also wanted to come back because last time I visited, I talked about how also residents' tax dollars paid to the state should be spent to secure public goods and assure basic rights and advance community and well-being. And instead, much of the money that Colorado residents are paying in taxes ultimately go to military spending and to buy weapons for Israel. Specifically for weapons that are for U.S. military spending that goes to buy weapons in Israel. We could fund public housing. Specifically, we could supply 9,097 households in Colorado with public housing for a year. Health and medical care, 26,629 children could receive free or low-cost health care. In this pandemic and the next, 66.5 million N95 respirators could be purchased. In education, those costs could support the salaries of 835 elementary school teachers, and 2,025 higher ed students in Colorado could have their student loan debt canceled. And
30 seconds.
Instead, thank you. Instead, our tax dollars through war expenditures and state investments advance occupation, displacement, and siege abroad. So again, I'm sure others in the future are encouraging the board to make a statement in support of the ceasefire in Palestine. Thank you.
Thank you.
Thank you, Lindsay.
Thank you.
Thank you very much.
All right, that concludes public comments.
Okay, thank you for those comments. Item number 2 is approval of the May 13th regular meeting minutes. To approve the regular meeting minutes.
Okay.
Okay, great. Motion and a second. All in favor?
Aye.
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 Thank you. Minutes are passed. Item number 3, program spotlight, administration and finance refresh.
My name is Jordan Bullard. I'm the Site Projects and Vital Records Program Manager for Public Health. And I've been tasked as the sort of lead project manager for the ANF refresh, which is what I'm here to talk about. And we'll start off with a little bit of a high-level overview. Next slide, please. I guess I forgot to remove the sort of staggered timeline.
You
So we
want me
can
to just build it all out?
just go ahead and run through them. There we go. Perfect. So prior to the pandemic, I think it's fair to say that our administrative and financial systems were a little tired. And the pandemic certainly exacerbated that. And it really pushed our systems to the max as all the folks that worked in our systems. And so once we had the chance to sort of look back a little bit more clear-eyed, we started on this process in the middle of 2022 with discovery meetings, which basically was identifying low-hanging fruit of places we could make some easy improvements before jumping into the more strategic work. And I'll talk about more of these in more detail as we move through the slides. But in the later part of 2022, we started process mapping each one of our processes within our 9 admin and finance areas. And in that work, we invited stakeholders from across the agency to do this with us, to map our processes as they exist. It wasn't aspirational. It was, for better or for worse, mapping each of the processes throughout our sections. As we were doing that, I and other members of the admin and finance leadership team did value add exercises, which we'll talk about more, but essentially we sort of separated the wheat from the chaff, identified what was worth keeping around, what was worth getting rid of, what was worth streamlining, and also what we had to keep in place because it was regulatory. We took a little bit of a strategic pause in the latter part of 2023, where our ANF refresh work was added to the sustainability, transparency, and stewardship section of the strategic plan. Once that decision was made, we started solution sessions in January of this year, where we invited stakeholders across the agency to join us. Each member of the admin finance leadership team presented what we thought might be reasonable solutions following the process mapping and the value add sessions. We just finished our final of 9 solution sessions last month. And with a little bit of a pause this summer to organize ourselves, we're going to do a soft launch of our ANF refresh later this summer, probably in August, with sort of continual analysis and process improvement later this year and into next year, with the hope that we'll sort of build these kind of processes in maybe on a yearly basis, kind of quality improvement processes moving forward. Next slide, please, Patrick. So this is an example of what the process mapping actually looked like. This in particular is for our grants process. So starting in December of 2022, as I mentioned, stakeholders from across the agency helped us do this by hand. So it was really important to have folks that work with our processes day in and day out, but don't live in those processes like we do on our admin and finance team. And so what you're looking at now, the teal Post-it notes are process steps, and the neon diamond Post-it notes are decision points. So we mapped out each process like this with input from folks from across the agency. And when we were done mapping the processes, we asked people to put their pink Post-it notes up on each process map, which identified as a pain point, which is very helpful for us because we don't always have the same pain points working within these systems as people have who sort of interface with these systems on a daily basis, but have a sort of an outside viewpoint from other divisions across the agency. Next slide, please, Patrick. So once we were able to map them by hand, we transposed our process maps into Visio, which enabled us to edit them and manipulate them a little bit more easily. We did this for all 9 sections. That's business operations and board of health, site management, contracts, purchasing, volunteer services, personnel, budgets, grants, and accounting and finance. And you may be wondering why each of the process steps has a little dot next to it. So we have green, red, and kind of hard to see, but we have yellow dots. Essentially, we broke those out into the green dots, meaning they're worth keeping. The yellow dots we identified as business necessary. And the red dots are, oh, thank you for that. And the red dots are process steps that basically we identified as we could potentially get rid of them altogether or streamline pretty significantly. Next slide, please. So this is the rubric on the left is kind of what we use to assign a value to each of our 401 process steps. And the first sort of step in this process was to identify who our customer was for each individual admin and finance section or admin and finance process. And in many cases, our customers are public health employees, or maybe it's the Office of Financial Management or Facilities Board of Health or a member of the community, whoever it might be. We want to make sure that that customer would be willing to pay for this step, not pay in a sort of traditional transactional way, but that the human power that's needed to go through that step is worthwhile, that it's sort of worth the squeeze. And so if they're willing to pay for that step, then we ask ourselves, does it change the product or service in any way? The answer there is yes. Was it done for the first time? If that answer is yes, then we assign that as a value add step. If you've ever done any kind of lean process improvement, this may look familiar to you. So the second question that's really important in this process is to identify whether or not the step is required for regulatory purposes, or whether it's associated with a third party that we don't have control over. That's obviously important to us because we're a local government entity, and it's very relevant. If the answer to that question is no, then we can identify that it's a non-value add. So you can see the breakdown here of all of the process steps that we mapped, all 401. We identified 32% of our process steps as value add. It's worth keeping around. We think people would pay for it. 48%, almost 50% of our steps are business necessary, which, no surprise, we're a local government entity. We're a little hamstrung in some ways, but almost 20% of our steps, there's a lot of room for improvement. There's a lot of room to streamline our processes and make things more user-friendly for our customers. I will say, though, within the 48% of our business necessary steps, we still have all of the notes that we took and all of the pain points that we received from folks that work across the agency. Even though we have limited flexibility within some of those business necessary steps, we can still make some improvements on some of those pain points. So what you see here, almost 20% non-value add. That's a lot of room for us to sort of minimize our own bureaucracy and our own red tape. I think there's even more room for that if you start thinking about pain points as well throughout all of our process. Next slide, please, back. So as I mentioned, starting in January, we did solution sessions with stakeholders across the agency and folks that we identify as change champions, a group of 20 plus folks across all divisions who have attended the solution sessions and will be instrumental in rolling out our new processes later this summer, kind of hoping that they'll act as emissaries on our behalf. We really want to make sure that we have buy-in from across the agency on this, because we can build out really good systems, but if people don't buy into it and if people don't use the systems, then we may as well not have done the work. So as we pilot the refresh later this summer, we'll also institute new practices to ensure our policies and protocols remain up to date. And thanks. That's okay. Remain up to date and relevant, and also compliant with any necessary laws and statutes. And kind of the hope here is, again, to establish some kind of cadence where we do the sort of quality improvement on our processes and policies, maybe on a yearly basis, with the kind of idea that like routine, regular maintenance is a lot easier to do than an overhaul every 5 or 10 or longer years, as may be the case for our policies. So we've done a lot of work to get to this point. We still have a little bit of work left to do to kind of get across the finish line for the rollout later this summer. But sort of looking forward, some things that we might be able to expect with the ANF refresh will include clearer processes, more concise forms and policies, and better resources in a central and easy to find location. And specifically, we've done a lot of work in each of these 9 sections, but a little preview of what's to come for our sections under business operations and Board of Health. We've constructed a Board of Health SharePoint page, streamlining Board of Health meeting processes, and we'll have annual agenda planning and meeting material creation. For site management, we'll have automated facilities request forms that will help us expedite approval and facilitate information sharing with the office management staff, with the facilities crew, and with the folks that are actually making the requests. For contracts and purchasing, we're streamlining communications directly with vendors and conducting informal bidding requests on behalf of program staff. So this is an area where program staff aren't necessarily the subject matter experts on how to navigate these processes. So taking them out of the process and relying on the subject matter experts here so that program staff, quote unquote, can focus on running their programs. For personnel and volunteer services, we've got updated hiring checklists, forms uploaded to the information center and available in DocuSign. For budgets, the hope is that we're building budgeting capability in OpenGov so that we're less reliant on spreadsheets. And we're making salary information more accessible to managers in a secure manner. For grants, we'll have a new grant intake form that will streamline our accounts receivable process and help us prioritize grant applications to ensure that they align with agency strategic priorities. And we'll also be reviewing compliance with uniform guidance for federal awards. And lastly, for accounting and finance, we'll have new budget to actual reporting for program managers and Oracle reporting for projects and division managers. So over the past 2 years, we have done a lot of work and we've had a lot of really good input from stakeholders across the agency. And we still have work to do. But it's been, I think, a little bit of a blessing that this has been folded in with the strategic planning work, now that we have sort of a scaffolding around the ANF refresh to ensure that we're able to hit some deliverables and make sure that we actually complete the work that we started 2 years ago. So I feel like I flew through that, but happy to take any questions if there are any.
Seems like a lot of work went into it, so thank you
Absolutely.
for that. And great to see some streamlining of processes, and I love eliminating unnecessary work. That's great.
This has been really well received by the staff in terms of just appreciation for the ANF team, who everybody in the ANF team worked on one or another of the processes. And it also helped us stimulate the county to think about some of its own processes in certain places. And the county is working on updates to contracting policy that should be really beneficial. So it's had, it's already reaped some benefits. And I know that as we implement it, it'll continue to support our staff to reduce the workloads, to provide clarity on both sides of the teams, the programs and the ANF staff. So thanks, Jordan, for leading the work, and thank you all who participated in it, including our program staff who gave lots of feedback.
Yeah, thanks. Yeah, thanks for giving us the overview here, Jordan.
Happy to do it.
Desiree Kazarosian, she, her pronouns, finance manager and interim director of finance. And we're going to walk through a few different slides. We can go to the first slide. Katie. Ending. So just some updates. We worked with the auditors this year, and OFM, we've been trying for a few years to give the auditors access into Oracle, because we were hand pulling all the information for them and having to present it. So now they're able to go in and pull their own information, which has been a significant time savings for the accounting staff. We're on track currently to meet our goal of completing our audit by the end of June. Any questions on that?
That's great.
Okay. Dimensions transition. Right now, the county is working on there's errors in the project upload. So the project component is important because that's actually where the grants live. So that's how we get the reporting for payroll for grants. We have it outside. It's in the general ledger, which is like the financial master listing, but they are posted in both places usually. So they finally got it posted to the general ledger, and they are still having errors and problems with the project. I know there's been an intensive push to get that fixed, but this morning we did have one of our staff members identify that something had posted 9 times for January. So the county took that information and they're looking at why that happened. So we are working with the county through all these errors. On IE, Accredis is in particular been working with them very tightly. She's our grant accountant and has identified a lot of different issues. So it's been great to have her collaborate.
And I'll just say the Dimensions transition was a huge project on the scale of the Oracle transition a few years ago. So there were bound to be snafus. And it's just the process of getting the system right. So we're really glad that a lot of those issues are beginning to resolve. It does offer some new opportunities for us in terms of system alignment.
So the other item I have here is they are forming a troubleshooting committee, and I've offered myself and IE to sit on that committee if they need us and would like our participation. For the budget and finance system, this is just more of an overview, identifying opportunities for improving efficiency, stability of data, projections, data validation, staff communication processes, optimizing use of various funding sources to internalize costs, strengthen alignment with funder interests and fund purposes. 24 budget updates, reduced spending and temporary savings. So we have not implemented any bonus structure or any trainings thus far. So there's savings from that. We have had a hold on hiring. So there's savings from that, other than critical positions that have been approved by director's team. Change of statuses are currently also on hold. So there's various cost saving measures that happen inadvertently because of just the time that we were spending evaluating what the budget was going to look like.
And I will also give a shout out to our programs who voluntarily reduced their spending to the tune of at least $250,000. And I think it may have been more just in the spirit of trying to conserve costs. So appreciate all of that solidarity.
Yep, they went through and identified where they thought that those initial temporary budget cuts could happen. And I think like Lexi spoke to the amount that we've already identified has already happened for this year. And there are other pieces that are in process. New revenues are reducing the fiscal cliffs. We'll get into that a little bit more. Also new costs and focus on full grant spend downs. So making sure that we have everything aligned correctly so that we are spending down all of the personnel and all the operating costs for grants. And we're not using other resources that could be repurposed. And we don't leave any money on the table with the grant process. All right.
Sorry, Desiree, go ahead. I know you're going to visit, I think, the new spendings. What's the new cost piece? What's that?
We will revisit
Okay.
that too. Yep. So this is the new revenues. So these are all of the new revenues that we've identified to date. And you can see there's some award amounts that are estimates up on the top for the Family Connects, and some of them are for various amounts of years. What I did is I just went through and added all the years of all the amounts. And that would add up to approximately $3.7 million over 4 years.
And these have all come in the last couple of months, and they are all new sources of revenue. And none of them include maybe small amounts of pass through, but we did also receive some grants that were full pass through and we did not include them. So this is directly addressing our fiscal cliffs.
And on some of these too, obviously there'll be programming that's associated. So there'll be personnel and operating costs, but there will also be indirect collected, which will benefit the budget. Any questions on any of these? So how does this 3.7 million compare to the anticipated like cliff?
So we had projected 2.5 million in funding cliffs for 25 and again in 26. Most of it related to either the Family Connects work or the MBH work, mixed in with smaller amounts for different programs. So the first line, the legislature Family Connects, has passed in the governor's bill. They haven't figured out the allocation to the different programs. There are about 5 programs across the state. So we're just waiting to hear what that allocation is going to look like, but we took a guess at an estimate. Daphne McCabe is working on confirming that in the next month or so. The IDD mill levy also supports that work in family health. The CHAP, CDPHE overdose, yeah, those 2 grants support our mental and behavioral health, specifically in harm reduction. So you can see that there's a mix in some different places.
Yeah, the waste tire is a funding source we've had previously, but we haven't had it recently. So that is just a yearly amount that we are receiving. All right, for the next slide. So new costs is the state increasing early childhood education inspection requirements for CHP, and then for WIC, it's $180,000 local match. It's more of a budget cut where we're being required to contribute towards the program, but it's across the state. They went through this analysis of all the WIC programming, who provided WIC services out of county, and then they had a process by which people would present basically the work that they were doing, and then they divvied up the monies between the counties based on a lot of different metrics. So I know there's a whole diagram that I've received of who got what for which counties and all of their metrics. So that information is available.
So 2 questions. The first is around the ECE inspection. I remember this came up once before about how we're going to cover those costs and who's going to pay for that. Has a determination been made?
We're still working on that.
Okay. I think I voiced my concern at having ECEs having to pay for that, given how tight their budgets already are. The other is just wondering how the local match requirements are going to impact our ability to provide services in WIC.
So on the first one, on the ECE inspections, we're one of the funding sources that we typically get is ECE and food licenses. And our grant this year from CDPHE, the contract, it's not a grant, it's a contract, went from 45,000 to 95,000. So that will help offset some of that extra cost. But we're working on what the budget looks like just to receive that one. And in relation to the WIC local match, we're trying to build it into our operations so that it's sustainable for us, but we're trying not to decrease services. Boulder County is actually held up at the state as an incredibly efficient WIC program. The number of clients that our program sees is way above the state average. And we're going to try to maintain that level of service. And we're still working on exactly how it's going to be absorbed. But we're trying to build it into a sustainable structure. So you can see why there's a need to kind of review the budget holistically to be able to think about the optimization of funding sources for various programs.
Any other questions on this one? For the next slide. So the next steps are to validate the 24 budget before staffing decisions based on the budget, continue our internal systems and procedural improvements, develop a draft budget for 8/19 Board of Health budget study session, prep for the regular Board of Health quarterly budget reviews, consider when and how to use the priority-based budgeting process, which is the budgeting for equity program that we're following with the county, continue advancing Medicaid billing systems with other departments. Any questions on any of these items?
We have the Board of Health budget study session scheduled for Wednesday, the 21st.
Nope.
So just a small correction. It's a Wednesday.
Not a number update, but date.
Anybody have any questions about what the next steps are?
Did you say Wednesday, the 21st? Because it's when, do you mean July? Is when?
August.
August, got it, okay.
Is the calendar not lining up with a Wednesday on the 21st?
No, I was thinking it too.
It's not.
That makes more sense.
August, there's a budget study session, and then when is it approved? September?
December.
December is when it's
December.
approved, but so we do a budget study session and then we have to present a budget request to this is part of what I think you're gonna work on for the board, Lexi, is like sort of comprehensive calendar that lets us know what are all the things that and the timeline and what we can what has flexibility on timing and what has a hard deadline. So that we can understand also what requirements are you, your team, and where there is space to slow down some decisions to make sure that we have all the information we need to make the right decision.
Anything else I can answer for you?
Lindy, any questions from the? Okay.
I believe that's the end of my presentation. We go to the director's report.
Go. Thanks, Desiree, of course. Item number 6, director's report.
So you see a picture of the 10th anniversary celebration of Boulder County Public Health's partnership with the Farmers Market on food security and nutrition programs. It was a lot of fun. We had a rain cloud that was continually moving around the group, having us rearranging chairs. And other than that, it was really fun to hear from folks who have run the farmers market for so long, folks who have grown food, nutrition programs from the state level that have worked with us, and just to celebrate all of the work that we've done over the past 10 years with them. On other news, you may remember that the legislature passed a bill to allow drug testing. This is particularly relevant in communities for testing pills for fentanyl because a lot of folks are having fentanyl overdoses because they don't know that the pills have fentanyl. And we're working with our legal department on how to best implement the new law because it's important for us in the fight to prevent overdoses and deaths in Boulder County. And this is a program that Denver has also spearheaded, and so we'll be working with them to learn how they're implementing it. And finally, just a quick update that the harm reduction program is going to begin some syphilis testing following on Dr. Belknap's presentation last month through an MOU with CDPHE to get free supplies and testing. But it's not quite up and running yet, but we were happy to share that we were able to move on that pretty quickly. And thanks to Georgia and her team and to Rachel Arndt and her team on some really great work.
Anyone have any other questions about the director's report?
Last month we asked about like public communication for the bird flu situation. I don't know.
For the
bird flu.
Oh, right. Did we have an update in the director's report on that?
It said it has an update on like numbers in the community, but I think the question was, are we doing any public communication about it?
Thank you. I will check on that.
Yeah, this is Indira. Can you hear me?
Yes.
Okay, great. Most of the public communication around bird flu is coming from the state health department. And that's traditional when we are seeing something novel. The State Health Department will take the lead on the public communication. And if we were to have a localized case here in Boulder County, we would work with them and then do our own Boulder County specific communication. So all of the information is being led by the State Health Department at this time.
Thank you, Indira. That's helpful.
If there are no other questions from the board, on director's report, then we'll move on to item number 7, old and new business. So much anticipation always, Jordan. What is going to be revealed? I'm not disappointed that there's nobody piping in. Okay. Then item number 8, adjournment, short meeting tonight. Yeah, it is 6:06.
Thanks, everyone who's online.
Thank you.
Thank you, everyone. Appreciate it.
Thank you,
Thank
Steph, for joining
you.
us.